to talk about errors now, common errors. And I need to find some room on my board. We're going to talk about an elongated image, and we're going to talk about a foreshortened image. What does elongated mean, do you think?
It gets longer.
Gets longer. Foreshortened, it gets shorter. Okay, let's talk about elongation first. It's kind of where the image gets stretched. Is that right? There's a T, there's an extra T in there, isn't it?
Yes.
Okay, all right. It's where the image gets stretched. Okay, up, that's where we are. Up.
Did that move?
Yeah, this guidelines, common angulation errors at the bottom, that's what I need at the
No,
top.
I know, but did the thing shift?
Yeah, it definitely did.
Yeah, it's okay, we're okay with it. Okay, your vertical angle of the central ray must be perpendicular to the film. What's another way of saying that? The vertical angle of the central ray must be at a 90-degree angle to the film. Okay? If it's not, if it's too vertical, if you have a vertical angle, okay, that's going to cause that image to be stretched. Can you imagine that? Okay? If it's too vertical, then that image is going to be stretched or elongated. If the vertical angle of the central ray is not perpendicular to the film, the image may be geometrically distorted. It will be elongated if the angulation is too flat and may result in missing the root apices. Okay? This placement can be correct. Okay? This placement here on this film can be correct, but because of the angulation of the beam being too flat, it's going to cause this to stretch so that the image, you're going to miss the apex. It's not a film placement error, it's an elongation, it's an angulation of the tube head. Okay, another way to, here's my film. Okay. If this is too flat, okay, it's going to cause the image to be scooted off of the film. Okay? If it's too high, it's going to squash it. It's going to be like it's squashed. Okay? And that's referring to foreshortening. Okay? So one error is going to produce a stretched out image, and another one is going to cause, the opposite is going to cause a squashed appearance, so that the image is shorter in appearance than the long axis of the tube. This is the tube, okay? It's the real size, okay? This is much longer than this because this image has been squashed or foreshortened, and it's caused by too much pitch. Okay, too much squashes your head. It squashes it. Okay, so if it's like this, it's going to be foreshortened. This is going to be elongated. It's just remember it. Not by my silly diagrams. Okay? A foreshortened image will result from a vertical angulation that's too steep. The image will appear shorter in appearance than the long axis of the tooth. Okay? Simply centering the cone with the XCP instrument ring eliminates both of these distortions. So if this is a Danaism, okay? It's flush and parallel. If your PID is flush with your ring, by flush I mean touching it all the way around, and parallel, see how that arm is parallel?
Mm-hmm.
See how that arm is parallel? This arm right here, this part is parallel with that PID or the bottle, okay? You're not gonna have any distortions, okay? So when I tell you I want it flush and parallel, that's what I mean, flush and parallel. And you're gonna check that every single time you take an x-ray, okay? Making sure that that PID is flush here and parallel with the arm. Because if it's not parallel, you're gonna get distortions, okay? Simply centering the ring with the XCP ring, the cone with the XCP ring eliminates both distortions. Okay. So elongation is too flat, and this is too steep. Too flat and too steep. Okay, we clear on that? Okay, cone cutting. If the central ray is not aimed through the center of the tooth and onto the center of the film, cone cutting will result. The central ray should be aimed at the center of the tooth near the cervical line between the root and the crown. Okay, cervical line through the root and crown. So the central ray is going to be aimed. Cone cutting shows a portion of unexposed film where the beam did not strike it. So it will leave, see how this is, there's like an area that the x-ray is on the image, you can see where it didn't hit. It leaves a void spot right there. That's what, no, cone cutting, right here. Where it cut, because it didn't go through this right place here, it leaves an area of the film that's unexposed. Okay, it's usually like a half circle, or it's blank spot. It's white. It's clear on the radiograph. When you process it and you look at it, you'll know you've got a cone cut for sure. It won't be a mystery to you. Overlapping an image can happen if the film is correctly placed parallel to the tooth, but the central ray is not horizontally perpendicular to the tooth, to the film. The adjacent teeth will overlap in the final image, and the desired tooth may not even appear on the film. If the horizontal angle is too distal, the tooth distal to the desired tooth will be superimposed over the desired tooth. So you've got two teeth on top of one another. You can't see between them. That would be extremely important in bite wings. You want to make sure that you're not overlapping on your bite wings. It's a horizontal error. Okay? So these are vertical errors. These are vertical errors. Cone cutting is a placement error. It's a placement and central ray error. And overlapping is a horizontal error. Okay, is that clear? Clear as mud?
Yes.
Okay. Horizontal error would be, usually it's in bite wing, so let's move to the bite wing. Place the film in. Okay, let's say I'm this way.
Okay.
That's a horizontal error. That way. That's a vertical error. That's a vertical error. That's a horizontal error. So vertical errors go up and down, vertical, and horizontal errors are side to side. So if I say it's a horizontal error, how are you
That just
gonna,
means it's not parallel with that arm?
with the ring and the arm, it means it's not flush and parallel, okay? Horizontal error, it's too far to the right or too far to the left. Up and down is the vertical. Horizontal is side to side. Okay? Alrighty. Now, let's get, I got this. I think I can do with this. Okay. So now let's talk about the placement of the individual films. Okay? We are going to start with the bite wings, not bite wings, the anterior, because for patient comfort, that's where we start. The reason that it's thought that you should start with the anterior teeth versus the posterior teeth is where are you going to be the more scaggy? Posterior. So if you start in the posterior and you trigger the gag reflex, you're kind of lost from the very get-go, is what the thinking is. Whereas if they're more comfortable and less gaggy in the front, you can gain their confidence, and by the time you get to the gaggy part, well, we're almost done. And that's very true and valid point, but there's all kinds of different ways you can alleviate gagging once it starts. There's antiseptic, anesthesia type sprays that you can spray in their throat, which is dangerous, and I don't do it. I'm just not gonna do it. So you can use anesthetics, or you can use salt. You put salt on their tongue, and that tends to paralyze that gag reflex. I like to use something very similar, very simple, and it's very effective, and it's always available. I have a patient cup and I have water. If the patient looks like they're going to start gagging, I have them take a sip of water and just wait for a second. Just relax. We're good. We have all the time in the world, even though, I've got 35 seconds to finish this. I'm not going to let them know I'm in a big hurry to do this. I'm going to take my time and let them know we're good, you're doing fine. It happens to a lot of people. Don't worry about it because they feel ashamed sometimes that this is happening. I'm sorry, I'm trying to be a good person, good helper. Just relax and have them take a sip of water. And then as they relax, then I have them take just one more sip of water, and not the whole cup, just a sip. What that sip does is it clears that gag reflex. When they swallow, it kind of moves everything back to where it was supposed to be, instead of being ready for it to happen again, and it's going to happen if you're in that situation. But if you're relaxed and calm, and that gag reflex is temporarily paralyzed by the water because it's just done its thing and it's kind of rebooting, if you will, and you can be in there and take that x-ray before the gag reflex comes again. Sometimes I have them take another, between each film. It just depends on their level of confidence in me and my level in how fast I can do it. I used this on a lady last time I did hygiene, when I was temping earlier in the month. And she's like, that was the easiest x-rays I've ever had taken. And all I did was give her a couple sips of water. That's it. Didn't cost anybody anything, didn't cost any much time. It was all just exactly what she needed. That's a little trick that you can, you don't have salt available. You have to run to the kitchen to get it. I have water right there in my operatory. So that's why I use the water. Okay, so we're gonna start placing the films. So we're gonna start, it says with a size 1 for anterior. Okay, so we're gonna pretend that we're using a size 1. Do I have size 1 film in here? I may. I think we do. We do. Yes, we do. Every time I get in here, I mess up everything.
No, it's okay. I go through it at the end of the course anyway.
Good. And you're the one that cleans up my mess. I appreciate you.
It's no problem.
I just tell you right off, I appreciate you. This is a size 1, and this is a size 2. You can see the difference. This is narrower and more comfortable for the smaller area of the anterior. See, it's smaller and. Okay, so we're gonna start with a size 1, dot and slot, white towards the light. And it fits in just like that. Okay, so then we're going to okay, so now we're going to take the canine and lateral. Okay, so we're going to place the film where the patient's going to be able to bite down on the bite block. So we're going to place it and have them bite down. Okay, move this 1/2 inch to their face, 1/2 inch to the face, line it up, parallel and flush, and expose. Okay, that's 1. The next is the centrals and laterals, because there's 4. Let's just take the central, let's do it like we're gonna do. Okay, we're gonna take centrals next. We're gonna place the film the same way, and then we're gonna go flush and parallel and expose. The next exposure is gonna be the canine lateral. So we're gonna go canine lateral, central, canine lateral. We're gonna do exactly the same positioning. Okay? Then we're going to roll it over, okay? And we're gonna come down here to 22 on the lower left, canine. We're gonna do canine lateral. Okay? We're gonna do canine, or centrals. And this, by the way, the film goes behind the tongue, not on top of the tongue. The tongue should be behind, on the back side of this. Okay, the tongue should be against that. Okay? Canine, or centrals, and then canine lateral. Okay. Then, we're going to switch to posteriors. Dot in the slot, white towards light. We're going to start in the upper right. We're going to take the molar. So we're going to have the molars centered in the film. Okay? very hard doing it on a typodont, I have to tell you. It's much easier doing it on a person. And they bite too.
And I hold it.
So we're gonna take canines, or
Molars.
molars, so we're gonna center the film on the molars. Okay? When you take a molar shot, you're gonna see the distal of the second premolar and the molars. Okay? So then the next picture that we do is on the same side. It's a little bit further forward. It's going to be a premolar shot. So what we're going to do is we're going to place the film, the distal of the canine, and that's going to put the film where the premolars are in the center of the
Mhm.
film. By using the canine, the distal of the canine as your forward guide, and the molars as your backward guide, you're gonna line it up so that the premolars are centered in the, okay. Then, we did the upper right. Now, this instrument is set up, it works in X, like an X, okay? So, the upper right and the lower left, it's positioned in the same direction. So rather than change it, and then get to the other side and change it, and change it, and change it, I'm only gonna change it one time. So I'm gonna take the premolar and the molar on the upper right, I'm gonna switch over to the lower left and do the molar, and then the premolar, using the distal of the canine as my guide. Okay, I'm gonna take the molar. Now I'm going to shift it, switch it. After I've taken a molar and a premolar, and a molar and a premolar. To change it, you're gonna wanna do this one way every time. Every time you do it. I think the light went, oh, there it
Yep.
is. Okay. You're gonna do it the same way every time. So you develop your own sequence. This is mine, and it works well, okay? And I can explain why here in a little bit. I'm gonna hold it in my hand so that the ring is closest to me. Everything is, I can see everything, okay? I'm going to take the bite block off and turn it over and put it back together. You always want to be able to see the film through the ring. Can I see the film through the ring?
Nope.
Nope. Nope. So, not only the bite block needs to be turned, but so does the ring. And I just roll it over. Just turn it opposite of what it is. Can I see it now? So we're good to go, okay? The reason I do that in that sequence, it never fails. I'm in the middle of changing it. Somebody comes to the door and says, blah, 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 your next patient's here, blah, 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 or, you know, whatever. Do you know where such and so is, or, you know,
X-ray.
whatever. They'll come to the door and just, and now where was I?
Mhm.
If I have it in my hand like this, and it's like this, I know. All I have to do is change it one more time, and then I'm right there. Okay? So it helps me to keep track of me and answer the questions and still deliver excellent care to my patients. So hold it towards you, roll it over, place the bite block, then roll it over with the ring. Simple. It's just a two-step process when the ring wants to cooperate. And as long as you're able to see the film, you're right. Okay? You might totally, you might get lost in, it takes a while to develop that, okay? So, wherefore the upper right and the lower left, see I'm right back where I started from. That's what I was talking about. So I need to roll it again. Roll it over one time. Roll it over one time. As long as I can see the film through the ring, I'm good. So now I'm set up to take the upper left molar, premolar, the lower left molar, premolar. Okay? Now we've taken 6 of the anteriors, we've taken 8 posterior, let's take some bite wings. Because that's all, and then we'll be done on FMX.
Full mouth X-ray. No, full mouth.
Full mouth survey, full mouth x-ray. FMX is full mouth x-ray. So, that goes halfway. You wanna place it in the bite block where you can see the film through the ring. Okay? Half, this bar right here makes it so half the lower teeth and half the upper teeth are gonna be shown, but no roots,
Uh-huh.
okay? Bite wings have no roots. Okay, so I'm gonna place it back here in the molar region, and I'm using the lower teeth as a guide, because they're easier to see. 1/2 inch, PID, flush and parallel, zap, done. I'm gonna move forward, distal of the canine again. It's always, for your premolar shot, it doesn't matter if it's a PA or a bite wing, you're always gonna use the distal of your canine as your, your marker, your landmark, your landmark tooth. Okay, and this one I'm gonna have to turn it just a little bit like I did with that patient, with the student that I had last week. I'm gonna have to just kind of inch it a little bit towards the center of the mouth. And that's my premolar bite wing. Then, rather than going back to the molar and doing the molar and premolar, we're gonna, on this one, we're gonna do what I call roundhouse. Okay, so we're gonna do molar, premolar, premolar, molar. So we're gonna jump over here to this side. All you have to do is turn it over like you do with the blue one, the anteriors. So we're gonna take premolar, using what tooth as the guide?
Distal of the canine.
Distal of the canine. And then we're gonna go back and take the molars. Okay?
Perfect.
See how that's done? Sorry, excuse you. Okay, questions about placement.
No.
We will go over it a lot next week. Okay? Okay,
You already did all these, huh?
yeah, I did all this.
Show them all.
The alternative projections, I told you about the midline, I told you about the distal molar projection. When you can't get back far enough, you can project it forward.
And that's for
There's-
wisdom teeth?
And then there's also, some dentists prefer a midline projection. They wanna see what's going on in the midline, right between the two centrals. So that would be your extra 2. We do 18, that would be your extra 2 to make the 20. Okay, that's in the book. Quality assurance. It's always, in order to prevent mistakes and that require retaking of radiographs, it's important to take steps to assure quality. One step is to check your tube head for drifting. To perform this test, this is the way you do it. You move the head into position and let it go. Watch the head, and if it goes, you've got drifting. If it goes, you've got drifting. If it deviates from where you place it on its own, you've got drifting. So then you have to have it would require an adjustment. Usually by a service technician, but not always. Sometimes the doctors will do it themselves. You have practical applications, and on all of those things that I just went over, your post-test, and your glossary in this book as well. Okay? Questions about that book?
No, ma'am.
What time were we looking at?
It's 1:20.
Okay, gotta hurry through this. We may not get to this.
I don't know, you might.
There's 2 books.
There's 2 parts to it. We had to split it up because it doesn't let me post more than a certain amount.
Okay,
So
well,
there's
let's get
10
through
right
the
here.
first- Let's get through the first part. section 6 is mounting, we can do mounting next time. Let's get through the darkroom, quality assurance and all that.
Yeah, 'cause
And
those
then we'll do mounting next week when I can, we'll start off in here next week with mounting. And, I want you to go ahead and study the mounting.
Okay.
It will be on your test. But, study the mounting, and then we'll discuss it in class.